All right, guys, we're back this week to answer some more questions. So we have a list of questions that you guys submitted online. So Sarah and I are both at Conceptions. We're taking like the team approach. So today we're both home. So we're here to answer your questions
Hi,
um,
guys.
from our house. Um, so we'll get to it. The first question is Conceptions making any decisions solely based on ASRM recommendation guidelines? Are we will we be making decisions based on other factors? If you're solely listening to ASRM, why?
I'll take that one. No, while we do appreciate ASRM and their guidance thus far, we want you to know as a patient that we are certainly taking the guidelines from ASRM seriously, but also we've been taking guidelines from the US and local governments, the CDC, ACOG, MFM, and so on. You should also know that there are teams of REIs, REI physicians from across the United States, and quite frankly, around the globe that are meeting frequently to discuss the safest and most effective way that we can provide care for our patients and restart treatment. Your care is really important to us. So we're putting a lot of time and thought into not only when we resume care, but how we can safely resume care.
Okay.
Mm-hmm.
Next question is it's an embryo question. So what causes an aneuploid embryo? So aneuploid means abnormal. And in this instance, it means abnormal number of chromosomes. So aneuploid embryo is a spontaneous deletion or addition of genetic material or chromosome in an embryo or gametes. Sometimes this error can occur during meiosis. That is when the egg and sperm are made. If they're not, when those gamete cells are dividing, if there's an abnormal split of the chromosomes, that gamete, that egg or sperm, are presenting an abnormal number of chromosomes. It also can happen in embryo division. And so Sarah had put it appropriately that it's kind of like mixing a recipe. So when you have an incorrect number of chromosomes, you should have 46 pairs of chromosomes. So when you have either 47 or 45 or those kind of combinations, it can cause that embryo to be abnormal and usually results in a implantation failure or miscarriage, or it can result in a child with a physical or mental abnormality. The aneuploidy rate, our rate of abnormal embryos, we see a definite scale dependent on your age. So the younger you are, the aneuploidy rate is a little lower, but as you get older, the aneuploidy rate increases. So we take those things into factor when we build your treatment protocol based on your age, your diagnosis, and those kind of things. Or do you have an abnormality in your family? So your health and your genetic makeup does contribute to whether or not you may have an embryo with aneuploidy. But again, a lot of it's just spontaneous. We see patients, who are perfectly healthy and same diagnosis as the next couple, and the aneuploidy rate differs between couples. And it's just a spontaneous event most of the time. So the next question is, has there been any change since your last video that we should be aware of?
I'll take that one. Yes, I think it is important first and foremost to note what this delay in treatment gave us, which was an appropriate amount of time to collect and process the data. And it gave us the ability to make a good, well-informed decisions for our patients. So that's really important to know that, because every day with this virus, we've gained new information, right? And that's helping to keep you safe and all of our community safe and families safe. We've also during this time gained a greater understanding of the virus and how we can effectively treat our patients while maintaining the safety of our patients and staff and families. and the community. So it's really important. But yeah, we've gained a lot of information. So that's the biggest change since the last video.
All right. The next question is, IVF doctors not able to, basically, are IVF doctors able to screen for cancer cells, diabetic cells, or mental health issues like depression or bipolar in babies and children when they are teens? Some of those things we can't screen for, but we're able to screen for embryos that have a known genetic mutation. There's 100 of these types of diseases. Mutations like the BRCA gene can be screened as far as cancer goes. So if you have a high incidence of breast cancer in your family, we can screen those embryos, those female embryos, for breast cancer, and male embryos, in fact. So most genetic labs have a lot of resources that you can go to their websites to get more information if you have a known mutation or genetic issue that you're wanting to know if they can screen for. So we typically, there's some good sources. We use Natera primarily. So you can go to their website. They usually have a list of mutations they can screen for. Also, iGenomics and NextGen MDX also has good material for to see if there's a disorder that you may want to screen for. Next question is, when do you think treatments will be allowed again?
So I'll take that one. Dr. Green, if you guys haven't watched it, just posted a video recently on when we think we'll be resuming treatments. There was a great meeting with a lot of RAI physicians within this week that kind of all met to discuss resumption of treatment. I think we'll be getting started very soon for everybody, and which is great. We're really looking forward to treating you guys again and seeing your faces coming in the office, of course, safely and socially distancing yourself appropriately. But I encourage you guys to call your nurse, because we are going to start treatments and resume treatments as they are appropriate for you. So call your nurse, reach out to her, and we look forward to seeing you guys really soon.
All right. Next question, is it safe to start the test now, or better wait to next month when the lockdown is over?
So we are open and have been open for testing. Our office has always been efficient with infection control inside of our centers, but certainly, each patient is going to have to determine somewhat of this decision somewhat a little bit on your own, because your individual health concerns and individual risk factors may impact whether or not you feel it's a good time for you to come to the office or not. Okay. But we're open. Remember, with each new day, we get more information on how to keep you safe. But currently in the office, we are definitely doing testing, and we are doing everything to keep you and your family and our staff and the community safe.
Yeah, and to add to that, we're also, we're watching webinars and attending meetings every day. As far as the industry leaders around the world, we're all talking about this stuff. And some of the things we're trying to look into is getting a biological passport. So trying to get a hold of some antibody testing that we could test to see if our staff and our patients have been exposed to coronavirus, and if they're somewhat have potentially some immunity. So those kind of things are, in the works daily. And so we're following that very closely and trying to be on the front line as far as being one of the first to be able to offer that kind of stuff. So we're still, like Sarah said, it's day by day. We learn more every hour, basically. And so we're watching. And so hopefully we have this kind of testing very soon.
Yeah.
Next question, can I start birth control pills on a Provera initiated cycle?
Yes. Call your nurse. Easy.
And then what qualifies an FET to be prioritized once you start transfers again?
That's a great question. I met with the FET team yesterday and kind of pooled together all of our patients to kind of look at them. And so the first patients that we're looking at are those that were canceled due to COVID, that were on medications and in their FET cycles. So we're going to be offering them the scheduling first and foremost. From there, we're prioritizing those patients with certain histories where a further delay could cause potentially a negative impact on their outcome. An example of this might be that you just had your recent polypectomy, or maybe you were on 2 months of Depo-Lupron, and that could indicate a more time-sensitive transfer. So we're looking at those next. Internally, though, I want you to know that we are looking at, and I think I mentioned this in a previous video, as we're looking and scheduling patients, we are looking at opening up an extra time in the OR, extra days, potentially weekends if need be, to get our transfer patients in a timely fashion. So as we're scheduling patients and needing to add more time, we have measures in place appropriately that we can implement if need be. So.
Yeah, we're taking, Sarah's exactly right. We're taking steps to, we're opening up a second OR. Since we're starting to gear up treatment cycles, because the goal is once some of these restrictions are lifted, we want to hit the ground running and get these patients through. And so, and there's kind of as you can say, downtime. We've also yesterday installed a new incubator that we can hold more patients. We're adding more technology and stuff. So while we're kind of on a treatment pause, Conceptions is still moving forward to be, to maintain the status of an industry leader. So we're installing some new technology. It gives us a chance to, improve the lab. So we are taking, every opportunity we can to move forward during this kind of crisis. And so that once we, are back to full speed, we're better than ever. So thank you guys for, being patient with us. And Sarah says, the nurses are working every day. They're a wealth of information. Contact those guys because they can get you on the track and, get you where you need to be so that once, we can resume your treatment and help you guys out and build your family. So
absolutely. I think just from the nurses in the office, in times of crisis, it gives us the opportunity to adapt and change and grow. We've done that as a practice. I think we've all done that as even just a human race. I'm seeing so many positive changes that have come out of this, and it gives me new hope. I hope it gives you guys new hope. I know it's sometimes hard to be hopeful. I heard a patient recently say hope is a dangerous thing for an infertility patient. But remember, hope cuts fear. So I recently heard that on a webcast, and I think it was really something that really hit home, having dealt with some stuff in my past too, that, hope cuts fear. So stay hopeful. We're here hopeful for you. And we're really excited to see you guys soon.
All right. Until next time, stay safe.
Take care. Stay safe.